So I remember years ago, you told me about data, and because you're an analytical chemist, that's what you do. You do data stuff. Your data, you analyze data. Here's the thing. Why do a test? This is why I quit chasing laboratory tests, whether it be a testosterone level, whether it be, I know how I feel, when I feel, what I'm supposed to feel like. Is the data going to change treatment? No. Right. I don't care what my glucose comes back tomorrow or right now. It is not going to change what I do. I know how to exercise. I know what my glucose does when I exercise, when I eat bad, when I eat good. It's not going to change. The number means nothing to me. So if it's not going to change the outcome, then why even do the treatment? It's like this. Like, for instance, I see people that the Aura rings. We've talked about sleep, the Aura rings. So somebody said, well, you should do an Aura ring. You know what? No, I don't want more data. I analyze enough data already when it comes to my exercise. I don't need more data. And there is nothing that ring is going to do to make me sleep better. I know what I need to do to sleep well. So why would I do it? It's like a sleep study. Our healthcare system makes a lot of money on sleep studies. Wait a minute. The number one reason people don't sleep and they have sleep apnea is because they're overweight. Okay. So why?
Or they're drinking before they go to bed.
Correct. That's correct. So why do a sleep study to get a CPAP when you can just eliminate those things? I mean, seriously. So one other thing, and I'll let you go back to what's normal. Okay. My wife is really good about giving this example. And this is so true. And I know people hate when I give analogies because I use simple analogies. I don't call myself a smart guy. I don't call myself a scientist. I like to just be rational. When you take your dog or a horse, give the animal, whatever, into a veterinarian, they know if it's sick. They're like, oh, yeah, your dog doesn't look good. What's the first question they ask, Shane?
What's he eating? And what's he eating?
What you been feeding it? Look at the dog's mouth or the horse's mouth. Oh, the horse has bad teeth. No wonder he's lost 50 pounds. He can't eat. Oh, well, oh no. But with humans, oh, well, you lack XYZ drug. Let me give you this drug. That's what your problem is. Or that's surgery.
That's standard of care now. And you think about what our grandparents used to do.
Standard of care, like Janet says, is not quality of care.
No. And so standard of care, it's just what they're trained to do. You can't blame doctors, but at the same time, it is their responsibility.
I've been in the healthcare industry enough. I blame my colleagues.
I agree.
I really do.
I agree. They should know what the healthcare system is teaching and what's best for patients.
Yeah.
But think about what our grandma used to do, right? Because they didn't have running water where she grew up. I mean, they were dirt poor. So you didn't go to the doctor, and you had all your kids at home. You just didn't go to the doctor. He probably didn't even come out and visit. I mean, they lived in the Missouri Ozarks. I mean, so seriously, it's just how it was, right? Remember what she'd always say when you'd say, oh, I don't feel well. Have you been pooping? That's
a good question.
That's what the vet always asks, right? Like when you say your dog's sick, is he pooping or peeing? Well, no, he's not actually. That's an issue. Right. That might mean your kidneys or your bowels are not working.
Or you're not eating.
Or something. Yeah, right, exactly. Or you're eating, but it's not being eliminated. Right. That's a big problem.
That's a problem.
Right? And so you have some kind of metabolic thing going on. But is there a laboratory test for it? Why don't, seriously? So obviously our grandma used to ask that. I assume doctors used to ask that question 50, 60, 70 years ago. They don't anymore.